to Women in Motion, a webinar series presented by the HSS Women's Sports Medicine Center and Education Institute. These conversations are designed to support women's health and movement across every stage of life. Today's topic focuses on a crucial but sometimes overlooked aspect of women's health: bone health. Whether you're an athlete or simply looking to better understand your body, this discussion will highlight the key factors that influence bone health and the steps that women can take to protect and optimize it at every stage of their lives. I'm Polly DeMille, and I'm pleased to introduce our speakers today. Dr. Marcy Goolsby is a sports medicine physician at HSS and the medical director of the Women's Sports Medicine Center. She specializes in non surgical musculoskeletal care with a focus on stress fractures and bone health in athletes. Calissa Hall is an exercise physiologist on the HSS Sports Rehabilitation and Performance team with over 30 years of experience in fitness and rehabilitation. She specializes in strength, balance, and functional movement training and leads the Building Better Bones Fight the Fracture program. Calissa is, is dedicated to helping individuals improve their bone health and maintain an active, confident lifestyle. To begin, let's explore how bone health changes over time and why it plays such a vital role in women's overall musculoskeletal health. So, Dr. Goolsby, can you describe just why bone health is important and how it changes over our lifespan?
Bone health is incredibly important. It's one of the things that we can work on and is important throughout our whole lives. As children, our bone density increases, especially as we're more active, and we sort of reach our genetic potential peak around early 20s. And so, all the stuff that you're doing as a kid and adolescent is critically important for building your bone strength so you can get to that max potential. And then there's a little bit of a decline as we go further along in life. And then as our hormones change, particularly in women, as we go through menopause, the bone health can decrease again, the bone density. And so it's critically important that we think about bone health as a lifelong process and as something that we need to think about and work towards improved bone health throughout our lifespan.
And are there certain misconceptions about bone health in women that you've run into over your time?
In my class, I get a lot of requests about just things that they've heard in social media and all the trends and the fads. And two of the biggest misconceptions for me that are brought up in the class and in my one on one training is that you shouldn't do impact training, that if you have low bone density. And that's actually one of the most important long term goals. We want to be able to aim for those impact activities and those higher load building, weight bearing exercises because that's what's going to stimulate the most bone remodeling. We want to make sure that we're prioritizing those exercises. We may not be ready for them in the beginning, so we still need to build a foundation of posture and balance and stability and strength and making sure that we can do all of those things that are higher impact activities, but we can do them and we do want to aim for them. And another one is that people think that all kinds of exercises are going to improve bone health. And while it's important to make sure that our fitness goals are variations and we're doing all kinds of things, we have to remember that not all exercises are going to have a significant role in building bone. So, take, for example, cycling or swimming. Those are great for overall fitness, but they're not going to have a significant role in your bone building strategies.
Huh. Any other misconceptions you've run into regarding bone health?
I think what's critically important is understanding that exercise is really one of the few things in our lives that can be a treatment at every point in every phase of our life. And as Calissa was talking about, the importance of strength training and weight bearing exercise is really important. To add to that, not every exercise is the same. We know that multi directional exercise is more beneficial to the bones than unidirectional. So an example would be, you would think running would be fantastic, and it is in some ways, but basketball, my sport, so I'm a little biased, is better because it's actually the multi-directional load. So in our teenage years and things like that, that's critically important. And we'll talk about it more later, but some things about exercise and your balance with nutrition can come into play too. So some of the misconceptions that more is better is not necessarily true. So if you're exercising a lot, particularly like an endurance sport where you're really burning a lot of calories, like running, if you're not getting adequate nutrition, that can have really detrimental effects on your bones. So the more is better it does not really apply in this sense. As long as you've got the nutrition to match it, that's what the really important part is.
So there's a sweet spot for
There's a
burn.
sweet spot, yeah, and there's an importance of nutrition as
Mhm.
well.
And a lot of people just think that you don't need to worry about bone health until you're older, and we need to be prioritizing it, as you said, from the get-go.
Yeah, and screening earlier, in my opinion, and especially as you approach those perimenopausal years. So we're not identifying it when somebody already has osteoporosis. We're trying to catch it early, and address it early. So, in part of my practice, I see a lot of bone stress injuries, commonly referred to as stress fractures and stress reactions. And it's important, depending on somebody's risk factors, how many injuries they've had. I will do a bone density test and do some more evaluation because I want to try to pick up those patients early if they have bone density issues. Education is really a big part of the treatment, just making sure they understand the importance of it and what they can do to prevent it from becoming more of an issue, particularly if somebody has nutrition issues associated with it. So there's something called relative energy deficiency in sport, or the female or male athlete triad, which is the correlation between exercise, nutrition, menstrual function, and bone health. And so, if somebody is not getting adequate nutrition for how much exercise they have, it often affects their menstrual cycle. So, if somebody's not on birth control, they might lose their periods, space out, lighten. That could be a sign that there's a deficiency in their nutrition compared to their exercise, called low energy availability or energy deficiency. And then that has detrimental effects on the hormones and the bones. So the misconception that osteoporosis or bone density is only an older person issue is also incorrect.
Well, I think that is a common thought, that it's something that, you think of as an older elderly population and,
Mhm.
and
Yeah.
don't think about it in somebody in like 8th grade. So
Right.
Right.
So, is it ever too late to address your bone health? You've just talked about how important it is when you're young, but is there ever a point where, you've already, there's nothing more you can do?
Actually, no, I don't. That's what I tell everybody I meet with is that it's never too late. An example would be I recently started training with this woman who, her words were, "I've been sedentary. I had a driver my whole life. I never walked anywhere. I never exercised." And she went and got her first DEXA scan in her 60s, and she had severe osteoporosis. So there was no indication or anything, but there's still a starting point there. There's still a starting point to start building those habits now and preventing that further bone loss, and either just staying where you are and not getting worse, or hopefully getting those numbers to go in the opposite direction. So there's always a way to prevent where you are and where you're going, and build those strategies and build those habits into your hopefully another 40 years if you're in your 60s.
And it's not all about the numbers on the bone density test. So, fall prevention is a critical part of the strength training. That's, if you don't fall, it's hard to break your hip. Obviously, you can't, account for every thing that comes your way, but addressing your fall risks in your home and strengthening and balance so that you can catch yourself if you trip or things like that is really important too. And then, in terms of being too late, that's something I also talk about in my younger patients as well. The longer they've been having something going on that's not good for their bones, the harder it is to get that back. So I try to address that really early and say, this is, and especially in the younger patient, like, this is reversible. We can improve your bone density, but we're going to need to address these issues and address them as soon as possible so they get resumption of their normal hormones and those types of things so that their bone density can improve. And strength training and exercise is a critically important part of that.
So, it's really never too late at any stage of life.
No.
Absolutely not.